thank you for joining us for TGH Ask an Expert, a live Q&A series. I am your moderator, Karen Loftus, joined by Dr. Meredith Thomley, board-certified dermatologist and assistant professor at the USF Department of Dermatology and Cutaneous Surgery. Thank you so much for being here today, Dr. Thomley.
Thank you for having me. I'm really excited.
I am too. All right, so we've got a great installment of this Ask an Expert, and it should be of broad interest to our audience as we delve into the topic of skincare. We had nearly 40 pre-submitted questions, so I would say that our audience is pretty engaged in this. We'll do our best to cover as many topics as we can in this limited amount of time. If you're watching and did not get a chance to submit a question ahead of time, please put yours in the chat and we will do our best to get to it as time allows. And a reminder, yes, Dr. Thomley is a medical expert, but please always consult your primary care provider or your own dermatologist for individualized medical advice. Let's get started, Dr. Thomley.
Let's do it.
All right, we had several questions about sun protection and skin cancer. So we're going to begin with this topic. One of our first pre-submitted questions we had about powder sunscreen. Is powder sunscreen effective? They said, my kids hate the cream and the spray, but they tolerate the powder well.
That is a great question, and I share with them. I love a powdered sunscreen. I think where they really shine is with reapplication over makeup throughout the day. And I also really like them in the hair part line because that's a frequently missed area, and creams and lotions just don't feel too nice on the hair. Unfortunately, powder sunscreens are not recommended by the American Academy of Dermatology as your go-to UV protection. And that's for two reasons. The first is that they actually don't have adequate UVA coverage. They're pretty good for B, but they're lacking in the broad spectrum of UVA protection. And secondly, of course, coverage is an issue. When you're putting on these powders, you can certainly not tell where they're going, if they're blowing in the wind or in the sand. And so you'd really have to cake them on heavy, and even then you wouldn't have broad spectrum coverage. So I'd probably opt for more of a lotion or a cream. Now, if your picky toddlers or even our picky adults don't like the sensation of sunscreen on their skin, I totally understand that too. There are alternatives. And for those folks, we recommend UPF clothing. So that's where the fabric is actually knitted to protect you against the sun's harmful UV rays. You pair it with a wide brimmed hat, sitting under an umbrella, and you're good to go.
That's a good point. Way to bring in the UPF. I think that's something that not a lot of people think of top of mind. Okay, next question we had about SPF. So, is SPF 30 versus SPF 50 meaningfully different? And also, can mineral sunscreens reduce inflammation? So we got a two-parter there for you.
Two-parter. We actually get this question quite a bit because obviously your SPF is paired with a number. What does this number mean? So SPF 30, I want to reassure you, covers you against 97% of UV rays. But when you bump it up to SPF 50, you get 98% protection. And so that 1% difference is actually quite minimal. And as you get higher and higher beyond 30, if you're in the 99s to the 100s, the difference is actually marginal. So we recommend SPF 30 and above, reapplied every 2 hours, more often if you're sweating or you're swimming, because perhaps that 1% difference can account for a little bit of human error in reapplication. So the higher is not necessarily better, only if used correctly over and over again. Now, you asked me also about tinted sunscreens.
Yes.
Or mineral sunscreens. These are the ones that have zinc and titanium, and these are my preferred sunscreens as well. And the question asker actually asked a great question. These do have anti-inflammatory properties too. So in addition to protecting you from the sun, they can actually inhibit matrix metalloproteinases. These are MMPs. And for those of you listening, these are the enzymes in your skin that help break down collagen and elastin. And we want to hold on to all of our collagen and elastin for as long as we can. So wearing your sunscreen can actually protect you from that as well.
Great answer. And I was going to say, I like how you accounted for that human error in the application of sunscreen, because that is very real. All right, our next pre-submitted question. When should you see your dermatologist for sun exposure or skin cancer concerns? And then also sort of tagging on to that, how do I know if a mole is cancerous?
So when should you come see us? This is a great question too. You know, unfortunately, there's not a nationally agreed upon guideline on when you should start skin cancer screening in young, healthy teens and adults. And so we go based off of some general risk factors that may indicate that you should get in to see a dermatologist. Okay, if you have any of these risk factors, you should make an appointment. That's if you have very fair skin, like myself. If you have any personal or family history of precancer or skin cancer, you might want to come see us. If you can look back into your childhood and remember some blistering sunburns or perhaps some tanning bed use, it's time to make an appointment. And then I think if you have other medical conditions, like you're immunosuppressed or you're taking medications that suppress your immune system, that would be a reason to call us as well. And then finally, if you have any skin concern whatsoever, so a changing mole, one that we would be more suspicious of is different than the rest of your spots and speckles. That might be because it's asymmetric, it's got jagged borders, multiple colors, a large diameter, or it's changing to start bleeding, hurting, bothering you, or if it just doesn't feel right in your gut, something's not sitting there, then go ahead and make an appointment. We'll take a look at you.
Wonderful. Thank you for that answer. All right, our next pre-submitted question, we're shifting gears to acne. How do you combat adult acne, specifically acne caused by hormones?
I think this is so important because at some point in time, somebody lied to us and they told us that we all grow out of our acne. And that's just simply not true. And in fact, we're seeing more and more adult acne that is absolutely hormonally linked. It's the hormones that are at play during times of puberty, but then throughout your whole life that contribute to acne pathophysiology. And in my clinic, I usually tell patients that there's 4 things that cause acne, and we have to treat all of them in order to gain control over the condition. So I'm going to bore you with the 4 main tenets of acne now. The first is the plugging of the hair follicle that has oil glands behind it. Then once you have that plug, the second is the bacteria that lives on the skin gets to throw in a party behind the hair follicle plug, brings in inflammatory mediators to the area, and all of this is under hormonal influence. And you can see how this is a complex issue requiring complex care. And even into adulthood, we have to address each of these core tenets of acne in order to get it under better control. So that's why when you see a dermatologist, there's not a one magic cream that's a quick fix. It usually requires multiple agents, long-term planning for us to really control that hormonal acne. Now, some ingredients that we use to target the hormonal component that this asker mentioned would be those that target androgens that are circulating in the body. So we have topical clascoterone, we have oral spironolactone, oral contraceptive pills, and then we always incorporate some sort of vitamin A derivative into our acne routines because it helps slurp up those oil glands that the hormones act upon. I hope that helps.
Yes, that was great. Very thorough, and I appreciate the bullet points. Just lay it out for everybody. Another pre-submitted question we have, at what point should I request a prescription for a stronger retinol than what I can buy over the counter?
Yes, so absolutely, you should request a prescription for retinol if you're using the over-the-counter cousins, retinols, retinaldehydes, using them nightly without any dryness or irritation. It might be time to get the prescription strength good stuff. So all of these retinols that are over the counter eventually get converted into retinoic acid, which is the ingredient that works on our skin to boost collagen production, inhibit acne, lift fine lines, and also dark spots. And so if you're already tolerating the stuff that's over the counter really well without any issues, it may be time to up your game with a prescription. This would also be the case is if you're treating your acne at home and it's just not cutting it. So you're still having breakouts with over-the-counter prescription, or you may need prescriptions instead.
Wonderful, thank you. And I just want to remind everybody who is watching, if you have a question you would like Dr. Thomley to answer, feel free to put it in the chat if you're watching on YouTube or Facebook. We'll take some live questions as we can. But like I said, we have a ton of stuff that we're covering, so we may very well be answering a question that you have. Let's get to our next pre-submitted question. This one asks, in your experience, how can patients use tretinoin successfully without compromising their skin barrier?
Yeah, so tretinoin, the way that it works is it stabilizes the way that our skin cells divide and then shed. And in doing so, it unplugs all those pores and it lifts fine lines and wrinkles. But also, in going through that process, there is shedding involved. And as your skin gets used to the vitamin A, it get really irritated, cause a lot of dryness, redness, even some discomfort on the skin. And so the best way to incorporate these is really low and slow. So at night, after you cleanse your face and you have dry skin, is when you use a pea-sized amount, teeny, teeny, tiny amount for the entire face, avoiding around the eyes and around the mouth, following it with a really thick, heavy moisturizer. And the key here is not repeating that again the very next night, but spacing out your applications when you're starting on one of these new active ingredients so that your skin can adjust and get used to it. I recommend doing it as few times as once a night per week. And if you tolerate that okay, then you get to do it 2 times a week at night. And if that goes great, then you get to do 3 times a week, 4 times a week, and suddenly you're using it every night with no issues.
I think that's very important advice. There's the building up. Okay, so another follow question to that. A lot of people talk about the retinol for aging skin. Is this something you would recommend for that? And what other skincare recommendations do you have for someone with aging skin?
Yes, this is about as good as we've got to a magic cream that can help aging skin. And I don't say that lightly. I really do think that everyone should incorporate a vitamin A cream into their routine nightly, unless you're pregnant or breastfeeding. We hold off on those folks. It's safe to use and really shines when used consistently over a lifetime because that helps build collagen, brings back luminosity and the support structure to the skin so that we can combat the signs of aging. This is only as good as if you've incorporated sunscreen into your routine too. If you're not wearing sunscreen, you're baking under the sun, and you're going to tanning beds, then all of your money and time spent on getting used to your retinoids is a waste. So you have to couple the two together, protecting your skin and then also contributing to its long-term health.
Wonderful. Okay, so very exciting. We have our first live question rather. I really like this one. Inquiring minds want to know, what is Dr. Thomley's skincare routine? What do you do?
This is very kind of you to say. Of course, I've got studio lighting and makeup on, but I'm just as flawed as the next girl. I think one thing that I've learned in my journey with my skin, and one of the reasons why I became a dermatologist in the first place, is because I really struggled growing up with my skin. I've got super, super sensitive skin and can't tolerate much at all. And so for me, it may not be the most exciting answer, but I keep it plain and simple. Every single morning, I'm using a tinted sunscreen. At night, I'm using a plain cleanser and I'm using a over-the-counter retinol, adapalene, or mixed in with a prescription strength tretinoin if I can tolerate it. Every once in a while, I might get crazy and do a vitamin C serum or an in-office procedure like Botox injections or lasers. We have to practice on each other, of course. But I really do keep it as simple as possible.
Love that answer. I think a lot of people will be encouraged to know that you can have beautiful skin if it's simple, you know?
Exactly.
Okay, back to our pre-submitted questions. This next one, what are the best treatments for stretch marks?
Oh, I really love this question. So, first of all, I think I want people to know that stretch marks are normal and, quite frankly, beautiful. They're a normal part of growth. So, that can happen around puberty when young folks are growing tall, big, and strong. And it can also happen around times of pregnancy, which is also wonderful. And they typically are genetic. So, if mom or dad had stretch marks during these periods of time, you might be so lucky to get them as well. When things are genetic and they're also part of normal physiology, then the treatments are really worth more in the act of prevention, right? So I think keeping the skin moisturized, massaging during times like pregnancy can help prevent stretch marks. And then once you have stretch marks that set in, you call your dermatologist, we can help treat these. Stretch marks fall into two big categories. There's striae rubra, which means red stretch marks, and there's striae alba, which means white stretch marks. And why this matters is your red stretch marks are newer, fresher, more immature, and sometimes more symptomatic. And the white stretch marks are more chronic. They've had time to become atrophic and depressed. And this implicates how we treat them. There's really good literature to support that the use of tretinoin, the vitamin A cream we've been talking about tons so far, can help with the appearance of stretch marks. But this, like anti-aging, is a lifelong battle. So it would require daily application for many, many years to see some benefit there. If you wanted a faster result, you would need to come in office for a more painful encounter, and that would involve things like microneedling and then different lasers that we have in the clinic. For red stretch marks, we can use a pulse dye laser that helps target the pink color, making it camouflage more evenly with the surrounding skin. And then for our white atrophic scars, we need to use something like a fractionated, non-ablative laser to help smooth the contours.
Wonderful. Sounds like there's a lot of options.
Before I move on,
Yeah,
I think embracing them is also a beautiful option, and that's usually what I recommend first.
love that. Love that. All right, our next pre-submitted question. All right, this is something that's top of mind for a lot of people in the skincare world. Are skincare products marketed as clean, safer, and are they more or less effective than those that are not marketed as clean?
So clean sounds wonderful, right? Especially when we're talking about our skin. I want to be clean. You want to be clean. I want my products to be clean. But unfortunately, it is a descriptive marketing term at this stage. So words like clean, words like organic and natural all sound amazing. But the definition of these really depends on the brand and the manufacturer that's creating them. There is no nationally agreed upon guideline for what it means to be clean. So in my opinion, what should you look for when you're shopping the aisles? What words stand out that hold to meaning that we can rely on? I always look for fragrance free, of course. I'm a dermatologist. I like when it says dermatologist recommended, clinically tested. These things hold more weight for me than words like clean. And then if you're really looking for a plain Jane product, what I would look for is the National Eczema Association's seal of acceptance. It's a blue circle that you can see on products on the shelves. And this tells you that this is about just as clean as it could possibly get.
Oh, I like that. I wasn't aware of that seal. I'll have to keep that
Yeah.
in mind. Okay, another pre-submitted question. There's a wide range of prices, as you are aware with products. Are expensive skincare products better than inexpensive?
I am so thrilled to tell you that not necessarily. Expensive does not mean better, as is the case with most things in our world that we live in. You know, when you pay a high market price for skincare products, what you're paying for is the branding, and that is the notoriety of whoever's putting out the product, and then also how beautiful the packaging is. You're probably even paying extra for a lot of things that we may not even want in there, like fragrance, glitter, exfoliative beads, lots of things that in the end can cause more harm than good. What I'm looking for is ingredients. So, are there ingredients in the product that are clinically proven and evidence based to work and do what they say that they're going to do? If you've got ingredients that are great, like vitamin C in a great formulation, if you've got vitamin A in your over the counter retinol, it doesn't matter the price. You know, honestly, you can get a great skincare routine for a cheap receipt at the drugstore.
Love that answer. I bet a lot of people's budgets love that answer too. Okay, so you sort of answered this next pre-submitted question, but I want to know if you have anything to add on to it. This one was pre-submitted, and it said, "What skincare habits and daily routines do you recommend that don't require too many products?" Like I said, you explained
Yeah.
yours, which was simple. Is there anything else you'd like to add to that?
No, I think that we've covered the basics. So sunscreen being the first thing that you need to incorporate every day. And then once you've mastered that and you're putting on sunscreen every single day when you wake up in the morning, you get to incorporate a vitamin A cream nightly. We talked about how to slowly incorporate it so that your skin gets used to it and doesn't freak out all at once. And then if you're doing sunscreen and you've got a retinol nightly, then we get to get a little bit more creative and fun. And after that, not to complicate your routine, but if you can handle three things, then I would incorporate an antioxidant in the morning. This would be something like a vitamin C serum. So those are the big three: SPF, vitamin A, vitamin C.
I love it. Again, the lists. I feel like that resonates with people. Just a reminder, anybody watching, if you have any questions that you'd like Dr. Thomley to answer, you can put them in the chat, whether on YouTube or Facebook. We'll see those come through, and hopefully we will have time to get to those. Let's get back to the pre-submitted questions. In the meantime, Dr. Thomley, what can you tell us about the effectiveness of red light therapy? Hot topic right now, right?
This is a very hot and trending topic. So everywhere you look, there's a red light mask, and you gotta wonder, is this something that I need? Gosh, they make it seem like it's definitely something that you need. But then you look at the sticker and think, oh goodness, this is quite an expensive investment. So the first thing you want to know is, does it work? Is it worth the cost? And it's a really long, convoluted answer. I'll give you the short of it.
Okay.
Red light therapy works, and there is good evidence to support its benefits in hair growth. So if you have female or male pattern hair loss, there are red light caps and red light hats that can be really effective for you. There's a little good evidence to support it's great in wound healing and acne. But I hesitate to tell you, The evidence for skin rejuvenation, anti-aging, is just not as strong as the current trends and marketing lead it to believe. Perhaps it's behind the times and it will get there. We will see that there's a great benefit from this red light therapy. But if there is, it's in daily use of these masks over the course of a lifetime. You know, one thing I've been saying recently to patients is it's probably my fifth line treatment for anti aging. We talked about sunscreen, we talked about retinol. If you go into office for injectable neurotoxin and then you're doing lasers each year, and you still want more, maybe then you can ask for a red light mask for your birthday or for Christmas. They do make great gifts. And if you're going to pick one out, what I recommend is you get the correct wavelength. So the red light needs to be 620 to 1072 nanometers in order for it to back up the claims that it's going to help you out. And I really would like for you to get the mask that's FDA cleared. There's only a few on the market that have this label, but if you're going to spend the money on it, those are the ones that I would recommend.
Those are very important notes. Thank you for adding those to the end. Okay, we have another live question.
Great.
This one is about microneedling. What are your thoughts on that? Is there anything you can tell the viewers about this procedure and maybe its effectiveness?
Yeah, I love microneedling. It's something that we train on in dermatology residencies so that your dermatology offices are definitely equipped to do. Where microneedling is really helpful, I believe, is in folks who have a history of acne scars or very fine lines. So it can improve the appearance of these. Sadly, with microneedling, it often requires multiple treatments for you to get the desired effect. But if you really stay disciplined and you stick at it, maybe you buy a package from somewhere, then you can absolutely see some benefits here. It's also not too much downtime. So you might be out for the next week looking a little red and looking a little bit scary. But for the benefits, I think it's absolutely worth exploring, especially if your concerns are scars or fine lines.
Wonderful. Thank you.
Yeah.
We have a comment here in the chat that somebody said, great information, Dr. Thomley. So
Thank you.
Appreciating what you have to share already.
I'm happy it's hitting home with someone.
Yes. Okay, next pre-submitted question. Again, you sort of touched on this with retinol, but if there's anything to expand upon.
Sure.
The question is, do you build up a tolerance to products over time, and should you switch it up maybe seasonally, if that's a thing?
Yeah, so you actually don't build up a tolerance to your skincare products over time. You know, when you first start using active ingredients like acids or maybe retinols, you may notice that there's a growing pain period where you have dryness, scaling, redness. And then suddenly once you get used to it, you don't experience those anymore and your skin just drinks it up. This doesn't mean that you've grown tolerant to the medication. It actually is a good sign that it's working behind the scenes, doing what it's supposed to be doing. So you don't need to switch it up to something that is going to give you burning irritation. Just stick with what you got going on. I do recommend switching up your products seasonally. You know, we live in sunny, warm Florida, and we're currently in our 2 weeks of winter, which is cold and it's dry. And so it absolutely warrants paying attention to your skincare products when these climate changes happen. It's going to be unique to each individual person and where they live. But for us, these past 2 weeks, I've kicked my active ingredients to the side and I'm just focused on moisture. So plain cleanser, lukewarm water, and then a thick, luxurious moisturizer. That's all we need for the day. Then when we get into the hot summer months, the humidity can actually contribute to increased acne breakouts. So you want to ditch your heavy products and go for things that dry down real nicely, like gels or lightweight lotions. And then, of course, if you're going to incorporate more actives because it's more warm and your skin is moisturized, like tretinoin, you've got to also up your sunscreen application because a lot of those actives make you sensitive to the sun.
Wonderful. Thank you for making that distinction between the seasons and how to change things up appropriately. Next pre-submitted question. This person has hyperpigmentation, and they ask, do you have any product suggestions or tips for someone to create a routine that they're actually going to follow with this?
No, actually going to follow with this is probably the key part there is, what is going to get me to stick to it? So hyperpigmentation is actually a really big umbrella term, and it doesn't speak to one specific diagnosis. So I think it'd be really important to get in to see a board certified dermatologist so that they can address your hyperpigmentation and give you the diagnosis that you deserve. Hyperpigmentation or dark spot could be as simple as sunspots like lentigines or normal nevi, Or on the other end of the spectrum, this could be a pigmentary disorder like a melasma, or in dermatology, a lichen planus pigmentosis, if that's the first time you've heard that Harry Potter spell. And depending on what is causing your hyperpigmentation dictates how we treat you. Now, for all of these things, one thing's for certain is you need sunscreen, because sun can cement hyperpigmentation into place. And for folks who are dealing with dark spots, I always recommend you use a tinted sunscreen. That's one that has iron oxides in it, because this not only protects you from the UV rays outside, but it also protects you from the visible light in here, and that can contribute to your darkness. Other over-the-counter ingredients that you might like for dark spots would be vitamin C, our vitamin A's. Niacinamide can be very helpful. And if these aren't cutting it, see somebody in office, because we can prescribe other lightening creams like hydroquinone, incorporate chemical peels and lasers, and we can really help you out.
Okay, thank you.
Yeah.
We've got a couple more pre-submitted questions to get to as we wind down on this wonderful live stream. It's been a lot of wonderful information. Okay, what are the most common signs that someone is over-treating their skin, and how long does it take to repair the barrier if there's been damage done?
No, this is super relevant. You know, we live in a day and age where people have 10-step skincare routines, and sometimes more is not more. When you use all these different ingredients, you can truly damage your skin barrier. And we talked about some of the signs and symptoms that's occurred previously with tretinoin, but it's really red, reactive skin that's flaking off and peeling. And when you apply your products, you're feeling odd sensations. So if your products burn, sting, or tingle, that does not mean that they are working. That means that you have gone too far, and we need to dial it way back and get to a simpler, clean routine, which is just cleanser, moisturizer, and sunscreen. Now, how long do you have to stick to this rather boring routine? Well, the skin actually takes about 14 days to divide the skin cells and come up to the surface of the skin, and then 14 more days for all those dead skin cells to exfoliate off. So it's a month before you've turned over your skin. That doesn't mean that you have to stick to plain skincare for just a month, but for the first 4 days at least is when we get transepidermal water loss that starts to slow down. And so you'll notice that the skin barrier begins to repair over the course of the first week, but it won't be to its fullest until 3 to 4 weeks.
Okay, thank you for explaining that timeline. I think that's good to manage expectations there.
Yeah.
Okay, so we have two more pre-submitted questions, and we have one more live in the chat. We're going to try to wrap this up around noon, but we may go a few minutes over just because this is just going so well. Let's jump in on the live chat here. This person wants to know, what order should I put my skincare? Should moisturizer go before or after sunscreen in the morning? I guess that's assuming sunscreen is different from the moisturizer.
Right. And I think that's the key step there. So in the morning, you wake up, you brush your teeth, you cleanse, okay? And then you can follow it with any sort of antioxidant. That's really when morning routines shine. So this would be a vitamin C, or if you've got azelaic acid for other concerns, it would work really great in the morning time. And then you want to follow it with a combination SPF moisturizer. We're all about being simple. So that's what I recommend, is use your sunscreen to its advantage by also being your emollient for the morning. Then you get to go about your day. When you come home at night and you got to remove all your makeup and all the dirt and grime that you built up, you want to cleanse once more. And then you get to do your vitamin A cream followed by a thicker moisturizer. Hopefully that helps. But if you have more questions, definitely come see us in office and we can personalize a skincare regimen to you.
Okay, thank you. Okay. This one might be a quick answer here. Do skincare products last longer if they are refrigerated?
Oh, this is so funny. So yeah, there are skincare fridges that you can buy. And the concept is that, you know, there is less bacterial growth and that maybe those active ingredients have a longer shelf life if you refrigerate them. Kind of like if you put your produce in the fridge instead of on the counter, it lasts a little bit longer. And it is true. It is very true. There are skincare ingredients that are heat labile. Those are ones like vitamin C, peptides, and your retinols. And so by putting them in the fridge, you could potentially extend their lifetime so that they don't oxidize or go sour sooner, kind of like a carton of milk. Now, do you need to do this? No, you don't need to do this, right? So all the testing for over-the-counter products has been done to determine that they're shelf stable. So you can keep your skincare where it is on your bathroom counter. no issues. I only say you could add it to the fridge if it would enhance the experience for you. So if you want to put your gel eye masks in the fridge to get them out and then give yourself a spa day, totally, you should do that. And then for my patients who have chronic dry skin and a lot of itch, we often recommend some over-the-counter lotions that have menthol in them. I recommend you put those in the fridge because when you get to really itching, clawing at your skin, you grab that menthol. It can be so soothing when they apply the product. So you don't need to go out and buy a fridge, but you can keep a couple of your products a little bit cooler.
I'm telling you, there's nothing better than the cool eye patches.
Nothing.
So refreshing. Okay, our last pre-submitted question that we want to get to. This one is about cosmetic injections. Are there alternatives to cosmetic injections to retain skin elasticity as you age?
No, this is really good question, especially for those of us that are needle phobic and we don't want to get tons of injections. We have lots of things in our arsenal in dermatology that we can use to help retain skin elasticity without making you suffer with any shots. So I think we've touched on many of the really important things that you can be doing at home, which is the sunscreen, the antioxidants, the vitamin A nightly. And if you're already crushing that game, then you would come see us in office because we can do other procedures that can help skin elasticity. These are things like microneedling that we talked about earlier. Radio frequency can be helpful. We have all sorts of fun lasers and toys in our office that can also contribute to skin elasticity. And, there are injectables that can help boost your own collagen. So if it's maybe a filler or a Botox fear, we have other injectables like calcium hydroxyapatite and polylactic acid that are injected, but they stimulate your own collagen to be produced. So this might be something that could benefit our patients.
Wonderful. Thank you so much, Dr. Thomley. This was such an informative live stream, and I appreciate everybody being interactive in the chat as well. So I think we just covered a lot of wonderful information today. So yes, thank you so much for joining us, Dr. Thomley.
Thank you. This has been so much fun.
Yay, I think it was great. All right, if you want to know more about skincare or anything in the dermatology space, please visit the web address on your screen or scan the QR code to take you there. Thank you all who have joined and submitted your fantastic questions. We look forward to having you again on the next installment of Ask an Expert, which is coming up next Tuesday. That's going to be February 10th at 12:30. We are back again and talking about kidney stones. That'll be with one of our board-certified endourologists, Dr. David Hernandez. Thank you again for joining us and have a great rest of your day.